Welcome back, my good people. All five viewers, shout out. Let's go. Here we go. We back with another video. Just trying to keep at it here, man. That's all I'm doing. I don't know. Yeah, I really enjoy making these videos. Thanks for joining again. Today we're talking about a little bit of a selfish level, a story I just published, called Complicating the Narrative: Healthcare Incentives Align with Treatment, Not Prevention. Yeah, I think I'm super excited for this. I've been working on it for a while and about 4 months, and the second part of it is going to come out in 2 weeks. And I kind of just wanted to explain a little bit of like what exactly this is, where I'm coming from with it, and what I aim to reveal in this conversation. So basically, complicating the narrative is a term used in solutions journalism, right? So the idea being that I don't know, I kind of see myself as an investigative reporter on some level, but usually investigative journalism dives into specific investigations, I guess, about uncovering information, uncovering hidden data, uncovering something that's kind of concealed from the public, and the conclusion is usually some sort of obvious injustice that is just supposed to be revealed in the end. But with complicating the narrative, I see it a little bit differently, and I really like this framework for journalism, and I see it kind of moving hopefully in that direction. And kind of what it is saying, okay, right, like let's take healthcare. Healthcare, I think if you talk to most people in the US, doesn't really matter where they are on the political spectrum, probably agree with you when you say we have a problem with our healthcare system, right? It's not, it's unjust, right? So, but I think a lot of the time when we have that discussion in politics, it kind of goes to pointing the finger. It's this policy. It's not, it's not spreading access, or it's, greedy corporations who are just trying to profit off of the illness of people. And I think in complicating the narrative, what the purpose is to maybe bring in a bit of nuance, right? And to say, well, what specifically is taking place? How is it going wrong? What are some things that people are trying to do about it? What are the things that people could do more? And I think what it does is it takes away this veil that we have in so many of our political conversations, where it just goes from that's good, that's bad, evil, good, whatever. It kind of takes away that facade, because I think with most things there's just there's a system, there's a way of things being done, and it just kind of the reality of the situation is usually much more human, and there's a lot of different avenues to try to really understand what's going on. And I think that's what complicating the narrative is doing. It's not so much let's uncover it and it's these guys who are messing up. It's let's understand this topic in a different level. So that's what I think I tried to do here. Anyways, just to jump right in, I don't want to get into too many details about it. If you want to read the article, you can go read the article. I'll put the link in the description. But just to start with, I was looking at chronic illness in particular, and healthcare incentives align with treatment, not prevention, right? And just to start, like one of the initial statistics I use is that the CDC reports that 6 in every 10 U.S. adults have at least one chronic condition, and 4 in every 10 have two or more. And if you just look at the world ranking for where the US is compared to how much we spend on healthcare, there's clearly a problem where we're spending so much more than practically every other country. I think it is more than every other country, but our results are not reflecting of that, right? We have one of the sickest populations, and it's difficult to know exactly why, but what I'm doing is I interviewed this guy named Dr. Pagone, Mike Pagone. He's the vice chair for quality and a professor at Duke University Department of Medicine. And in that conversation with him, he kind of brought up the idea that we it's we have a system that better compensates treatment than it does delivering preventative services. And part of that is just because of the way in which the payment system works in healthcare, right? And we don't really always see it as such. We kind of see healthcare as like, well, it is what it is. The way it is either available to people or not available to people. The rest of it is just up to where science is in this moment, right? But what he's saying is actually a lot of the research that's done, right? A lot of the focus, a lot of the way in which healthcare works and is viewed by people is driven by the fact that we almost purely have an incentive to focus on treating people, right? Because that's where that's where the money comes in. You don't really make a lot of money if you just go around making sure that people are healthy and that they stay healthy, right? So that was a super fascinating conversation. But just to continue into that, he also brought up that, we have an implementation gap and not really an information gap, right? There is the knowledge out there where we know how to teach people how to live a healthier life, how to make that a part of healthcare, right? But we just don't really have the avenues to implement that. And so the next part of the story I bring up is Public Health 3.0. Public Health 3.0 came up, it was established in 2017 by somebody named Dr. Karen De Silva. And so I listened to a podcast where she was, kind of describing what she was seeing and what the purpose of it is. And really what it does is it comes from this realization. It comes from this realization that our system isn't focusing on the right things, right? And so Public Health 3.0, she sees that, there was 1.0 that took place early in the 20th century, and then, about halfway through 2.0 came out. And it's part of this progression that took place in the 20th century that increased life expectancy in the United States by about 25 years. And this is kind of the next stage. And she sees it, her kind of, her emphasis is in looking at the prevention side. But a lot of the plan has to do with kind of shifting the lens that the people who are already in charge of healthcare, what they focus on, right? And in increasing the amount of data that they have, her big part of the strategy is increasing the amount of data given to health departments because she thinks that, the more data that you have, the more ability you have to react in real time to things that are taking place. But ultimately, what she wants to do is use kind of the same institutions that are currently being used right now. At this point in the article, I kind of pose a question towards Public Health 3.0 and the people who are pushing it, which it is a National Institute of Health kind of platform at this point. They've kind of adopted it as the strategy to address these things that are taking place. So I asked the questions, is the existence of our chronic health crisis the result of our institutions focusing on the wrong things, as Public Health 3.0 assumes, or is the crisis the result of the culture generated as a result of these institutions being the primary motivators in healthcare? Have the business, technological, and governmental sectors responsible for our health earned the right to receive more power and ability in leveraging our data in order to address our health needs? In other words, can we trust these institutions to self-correct? Furthermore, are there other strategies and institutions of knowledge we can look to in order to pursue a cultural shift towards a holistic approach to health and prevention? Basically, is this the way? Is this the only way that we can make this shift? And not only that, is it even possible to make this shift in by using the certain parameters that are already there right now, those parameters that are already in place? So I like to leave that question kind of like open, right? I don't answer that question at any point in this article because I don't really know. I don't know for sure. But what I do is I shift then to a specific example of a community of people in Chicago, Chicago's Pilsen community, which is one of the nation's largest and oldest historically Latino communities. And I found this organization, this coalition called the Papalotzin Healing Collective, right? Because I was just kind of searching for how are people pursuing holistic medicine in different ways. And I thought this was like a really good example of something that isn't just like in your face advertisement. We're going to make a bunch of money off of you. It was more genuine, bringing the community together, right? And so what I found a collective of individuals who were focusing on relearning the lost knowledge of their community. They all had Mexican or Central American, South American roots. And a large part of those cultures for a very long time have had health practices. And as Western medicine has grown and grown and grown, and also beginning with colonization, those things really took a backseat to a lot of the health practices that we have today. And in the face of a system that is failing. They're seeking to relearn some of those things. Well, these things that we're doing now aren't working. Maybe we can look back to the things that are a part of our culture. Maybe there's something there that can help us fill in some gaps and change our perspective on health. So a big part of what this coalition believes in is that you can empower a community. Health can become a place of empowerment, right? If you're a marginalized community, by instead of looking to institutions that are in control of your health at this current moment to change and just waiting and waiting and waiting forever for those changes to be made that you seek, that you need, instead of doing that, taking action and coming together as a community to help one another become fascinated, curious in this sort of health practice, and then coming together, holding each other accountable, or just helping each other in the journey, right? Towards becoming healthier and having that conversation and growing an empowerment and growing something that is not necessarily a product of or even something that can be adopted by the current means that healthcare is distributed, but by creating a parallel or competing system, and not necessarily, to the extent of how big it is, but more so on an individual community level. Like this is what we're doing about our health in our community, and we're not going to wait for you to impose some sort of policy for us to do that. I learned so much from talking with these people, and I learned so much about the particular practices that they do. And the next piece that comes out in 2 weeks, I dive into a little bit more about what those specific practices are, and not only that, but research that kind of backs up not necessarily exactly what they're doing because there's not a lot of research behind it, but research that points in the direction that there are different strategies that we don't use in mainstream health that clearly and obviously can help us become healthier, right? And to finish the article, because I don't really know, right? At the end of the day, I don't have the solutions. I don't know exactly what the right way of going about it is. But I wanted to pose these questions and just bring the existence of an organization like this to the people who are in charge of running Public Health 3.0, because a big part of what they want to do is include social determinants of health and the different practices that different communities doing and trying to bring those to light. I have my doubts about their ability to do that and how sincere and how deeply rooted they are in that. But I did talk to somebody named Marcia Morales, who works to implement Public Health 3.0. And she told me that she's been doing this for years. And she has worked alongside community health workers. And what she's been doing is, she worked in Wisconsin, she worked with doulas who help with childbirth, and she acted as a sort of in between these sort of indigenous groups that were trying to use their own medicine and their own strategies for childbirth, and then kind of being a communicator with physicians who were there to kind of try and do things the right way. And she ended up pushing back a lot towards physicians. And she told me a lot that, physicians, they have this sort of attitude a lot of the times they come to the table. I know exactly what to do. I studied this. I have years of experience. What you're doing is wrong. And she kind of helped to be that sort of a moderator where yes, you can teach people, you can include, science specifically based practices, but there are things, you're not an expert in their community, right? And like Western science isn't the first time that health practices had ever been introduced, right? The health has been around as long as human beings and our ways of going about it, right? And so she kind of acted as a sort of moderate. And I finished with the quote of what she said. I think that there's definitely a lot of opportunity to continue making that impact. Kind of maybe not so much. I think the conclusion here is not so much one system is bad and one is good, but there are things that we, as in a system that is not really working so well, there are avenues to look towards other cultures, other practices, just other alternative ways of looking at it, just because of the blinders maybe of what financial incentive does. There are other ways to look at it, right? And ultimately, through talking to Marcia, she really believed that there are avenues where those two things can come together. And I think that it's very much up for interpretation whether or not that's the case, whether or not different ideas will be taken seriously or not. But I think it's the beginning of this sort of a shift, right? But I think ultimately she's hopeful of it. But I still go back to the question, can we trust the institutions that are already in charge of our health, that already have so many different things tied to them, so many different incentives that are not necessarily connected to health? Can we trust them to self-correct? I don't know. It's not really up for me to decide, but I'm going to release another article in 2 weeks about it. And I'll probably do another video at that point. But anyways, I hope you all have a great rest of your week. Enjoy the weekend. Happy St. Patty's Day, and thanks again.